There you go.
Okay, you good? Yeah. Okay, guys, welcome everybody to the People Policy Development Committee for September. Okay, first item on the agenda is apologies, Alison.
Yeah, only apologies received from Dave Howes.
Okay, thank you. Second item on the agenda then is disclosures of personal and prejudicial interests. Anybody for anything? No, didn't think so. Okay, and then to approve the minutes of the last meeting that was in July. Are we happy with those minutes? Somebody happy to move those minutes?
I'm happy to move them.
Thanks, Steve. Somebody second that?
I do that, Steve.
Thanks, Paxton. That's great. Thank you. And then we're on to the main item in the agenda then, which is the summary report of the work that we've been doing over the last 12 months, which has obviously been massively affected by the pandemic. I don't have to say that. So I know Simon's on the call now. Before I ask Simon to just discuss it, just to present the report, just to thank him massively for the work that he's done, not just on this report, because he's the person who's led and written the report. So huge thanks to him for that, but also the work he's done for the last 2 years, really. He's been a sterling support to the committee. So Simon, you okay to come in and just say a few words on the report?
Sure. Yeah, that's fine. So it's a summary. Can you hear me?
Yeah.
Yeah. So it's a summary of all the work undertaken within the work plan 2019-2020. The impact of COVID is considered within the report, you know, because obviously that towards the end had an impact on the direction of the policy work. So there's two significant areas of policy work that were within the work plan, as you know. Transition and is the first one, and the second one is the strategic approach to commissioning. So within the report, so section 2.2 talks about how we agreed these areas, and we had a scoping meeting, if you remember, if you think back, and so a number of policy areas were pushed around, and it was these two that were alighted on, partly because as many of you know, and our experience is that transition particularly is a very complex policy area. It's just something that we historically get a lot of feedback about from parents and carers. It generally involves multi-agency working, quite complex multi-agency working, and there is a sort of an experience of a step down approach from children's services to adults. So, you know, those sort of things, and also from the strategic commissioning point of view, the Social Services Act has raised this challenge really around new models of delivery and what councils can do to actually encourage a more diverse marketplace for social care, and that was this policy development was seen as important in taking that forward. So in terms of the scoping meeting, those are some of the themes that we discussed during that meeting, and then we alighted on that. So section 2.3 talks about co-production. Now, this is like the letters within the stick of rock within Swansea, really, of how we work in terms of policy and commissioning, and that our preferred mode of looking at service development is through a joint one with citizens, with groups, with communities, to actually build ownership of the service or of the policy or of the the strategy. And that's we've had various presentations on this during the both last year and previously around co-production, and it did feature strongly in the early presentation around strategic commissioning, and also in terms of our approach to transition, as I'll come on to. So I've said in this report in 2.3 that the People Policy Development Committee has been very supportive of co-production as an approach to developing policies, and I hope that continues really. Section 2.2, the next two sections in 2.4 are the two tables really that sort of act as a summary of the work. So if you look at anything really around those two areas, this tries to summarize the work that we've done. quite simply. But obviously, then there's more detail to follow. So again, with transition, like I said, it tells you why we've chosen this area. And what an improved transition would look like in terms of it being built on better coordinated support for the young person, enabled by joint working and close professional integration. It would avoid unnecessary changes or handovers, which create uncertainty. So it's basically, that's a sort of seamless approach that we would be looking for to meet fairly complex needs, obviously. Then the next part of the table is around how it fits with policy commitments. And there's a read across to obviously the rights of the child and the young person, who the leads are, the work that was undertaken. Now it builds from early on in the process was a transition conversation, which again leads back to the co-production approach. And then meetings were held with, a meeting we held with the Parent Carer Forum representatives. And so forth. And then, so the outcome of this work around transition, as is stated in the table, is that we have a draft policy framework, which we have had sight of. And there are new arrangements going forward to work co-productively with parent carers and young people. And that will achieve, in the long term, better outcomes. So that's the table summary of that particular one. The next one is strategic commissioning. As I mentioned, we have to, under the Act, look at new models of delivery, and also involve people in the design and operation of their own care and support as part of the Act. Again, this reads across to a policy commitment around intervening in the social care provider market. And the lead for this particular one was Jane Whitmore and Lisa Banks. Our work was undertaken firstly in terms of a workshop within the PDC, and then we discussed then the bid that was being put in for the Foundation Economy Challenge Fund and a pilot project proposal. And we received regular updates from policy leads. So the outcome has been really that we've had a successful bid to the Foundation Economy Fund, and a pilot was, scoped out to be underway, where there was some impact of COVID, but actually I think the work is still being gone on a more of a desktop level. And the next steps are that we will continue to receive feedback on that. So the next parts of the report just go into more detail of basically what I've said earlier, really, and of the work undertaken. But in terms of 3.4, it does reference to the fact that we have now a Parents Care Forum, which wasn't the case early on in the work around transition. And it whilst, so that development has happened alongside our process, really. And so it mentions that. It also mentions the best practice framework by the Children's Commission around Don't Hold Back for transition. And again, a bit more detail on the next steps. Similarly, around the transition fund, it did mention that in the strategic commissioning that we've got a couple of best practice examples that we considered in the process: the Somerset Micro Enterprise Project and Solver Care in Pembroke. And again, key policy developments in terms of a partnership agreement within, because Swansea Council for Voluntary Service actually attended one of our meetings, I believe, didn't they? And I think the Wales Cooperative Centre, I'm not sure if they actually attended or would plan to attend. And it talks about the outcome for that work as well, which is about putting people at the centre of their own care and support. Section 5 is around the policy developments, and this leads us, I guess, forward into, this is about drawing a line, particularly under the last year's work plan. This leads us bridges us into the work that we need to do around our response to COVID-19, and there has been a need for business continuity, but now we need to plan how things are going to be different going forward. It also touches on the work around supported living that we did underline earlier on in the process. So that's the report, really, Kerry. Do you want me to say anything more about it?
No, that's fine, Simon. Thanks very much for presenting and obviously doing the really hard work and putting it all together, because it's quite a comprehensive document as well. So many thanks for that. Is there anybody on the committee who would like to say anything at this point or ask any questions to Simon or myself? Mike White.
Yes, just a question perhaps for Simon, if he's able to let us know. Has there been any increase in referrals since COVID to the department?
I can't answer that in relation to this particular report, because it wasn't an area I was asked to look into. I mean, I'm working at the moment on the director's annual report, and all I can say is that the contact, the common access point for adult services has been busy. I think there's been some information on the staff intranet about that, isn't there, fairly recently. And similarly with children's, from what I look at in the information, things have been remarkably consistent, really, because in a sense, need doesn't change, does it, from adults and children's? I mean, in some ways, probably that, needs changing in some ways, isn't it? In terms of public health and things, but actually need for social care remains fairly constant. So the level of calls that we're getting are consistently high before and after COVID, really, and the work that's undertaken are, I'm seeing similar levels of activity. So I didn't specifically look at that area, but that's what I know.
I mean, in answer to your question, Mike, I don't know if Paxton has got anything he could add in terms of being the chair of the Children's Services Scrutiny, if that's something you discuss.
I think we were hearing today, Chairman, that basically there hasn't been a lot of difference, has there, Cyril?
No.
Right? That's the message we were getting, and if anything, it's been slightly down a bit, but not an awful lot. And I think they were anticipating that there might be problems arising out of that, but it doesn't seem to be the case. Now, obviously, with the lockdown, there was concern about domestic violence and the impact that would have had potentially on young people, but it doesn't seem to materialise to any great extent. And that was the sort of message we were getting, I think, so, wasn't it?
Yeah, that's right, yeah. So we've made, the service has been about making adjustments, adapting to the new situation, but actually, fundamentally, the interaction with people has still remained the same. We still have to safeguard our most vulnerable people and children, and react in that way, don't we? So we welcome the calls coming in from citizens and carers and concerned professionals and things like that, and in the same way that we always have done. So the adjustments are around face-to-face contact, which isn't really the highest part of our, a lot of our business is conducted by telephones, by calls into the service. So,
Paxton, did you want to ask something else as well, or was that the reason why you had your hand up?
Sorry, that's why I had my hand up.
I'll bring Mike Lewis in then. Mike?
You touched on the supported living there, Simon. Has there been a great increase in the cover of vulnerable people that are being supported during the COVID crisis, or has it sort of remained the same, or have we had to push a boat out to get a little bit more cover for them?
Well, I think there has been changes, isn't there, in service provision. Obviously daycare, day services is an area where there hasn't been the level of service provision as a result of COVID, but and there has been adjustments in individuals' packages of care and support, in which sometimes their supported living can provide that support, their arrangements, and we have other services like flexible support and domiciliary care, where that support can be provided in a different way. Also, that we've got our relationships with third sector providers, haven't we, that can also enable support to be accessed to people to attend well-being support and well-being type services as well. Even through the difficult times we faced. I think there has been, what has been remarkable about the story is that level of adjustment that staff and services users have been willing to make around how they receive support. So, yeah, I mean, only from what I know, again, looking at some of the information I've been processing, really not so much related to this report, but it's about that service adjustment and, people still getting supported, but in slightly different ways,
Okay, thank you.
Cyril?
Yeah, thank you, Chair. So I understand what you're saying about our officers and our workforce can't go face to face. We heard in our previous meeting that they are making leaps and bounds with the children, and I can understand what you're saying. Elderly is just one thing. Children, it's all different sorts of things. So they need that face to face. When do you think you will be able to get back to face to face?
Well, I think for me that is something that the will have to be considered as part of this, what I think is being called modification planning process, or that Dave alluded to in the last meeting. Really, that I haven't really been a party of the development of those plans. I think the council's terming them as recovery plans. So within social care, I believe it's something like modification or something like that, isn't it? And that's the sort of work that we're going to have to be, or we've been tasked with looking at going forward, isn't it? So there are plans or provisional plans that have been drawn up, and I think scrutiny have had sight of some of that work. So the question for this group, I guess, is where does the policy development committee fit with that? In terms of what's word that needs to come out to develop that, really. So I wouldn't like to say too much on that, really. I think it would be for us to have a dialogue perhaps with the senior managers in those individual service areas who've drawn up the plans.
I mean, I think that's good. It's timely to bring that up, Simon. I think that the process for drawing up that transition or recovery plan, whatever, modification plan, whatever you want to call it, is going through the senior management group and cabinet. That process currently, and will come to full council in due course, and that will obviously direct and structure the work that our committee will do going forward. I think we probably know more about that by the next meeting in October, on the 21st, I believe it is. So there's not much to really add about in terms of putting meat on the bones today, but that process is going ahead, behind the scenes as we speak, and we'll, as the council, the members on the committee and the full council get to hear about that in probably within the next month. So. I know that there's a safeguarding strand to that work, obviously, which cuts across adult and children's services, as our work already has always done in this committee. So there'll definitely be a role for us in some way around that, and I very much hope that work around strategic commissioning will form part of the next work plan, because I think with the transition work, I think we got to a point just where COVID hit with the lockdown that we'd really taken it as far as we could because of the next stage of it being a regional response and a regional approach to transition. So I think we'd done what we could for Swansea, and really COVID didn't really affect that. I think we got to the point where we'd done everything we could. And as you rightly mentioned in the report, Simon, it was done very much in a co-production way. And I think that's something we should be very proud of, really. But in terms of that commissioning work, that was just getting exciting, I felt, anyway, in the work that Jane and Lisa were doing for us and with us was really interesting. I know it's one of the most interesting things that I think we've covered in the committee. So it'll be really exciting to get back to look at that, I think, because that was a real shame that we haven't been able to move that forward because of the pandemic. But okay, the next stage, and if anybody hasn't got any other questions on the report, and I don't, just should say thanks, Simon. The next stage really is if we're happy as a committee, I will share this report with the relevant cabinet members, and then it will then go forward as it did last year to corporate briefing and then onto the cabinet for sign off. So I think that correct me if I'm wrong, Alison, but I think that's the process, isn't it? So is that correct?
What are you going to be asking Cabinet to agree? That's the only thing we need to consider, really, or is it just going for information?
It might go for information. I can clarify with the Cabinet members when I speak to them, Alison, and come back to you. But for today, all we really need is the committee's consent, really, or happy for this to go forward. There's no major amendments that you'd like to be made. Are we all okay with that?
Yes, I'm quite happy with that.
Yeah. Anybody not okay with that, I would ask. Sarah, do you want to say something, or are you just...
I was just going to say, I'll say yes to take it to Cabinet or whatever, mate.
Okay, that's great. That's fine. Okay, so in that case, then that's what we'll do. So thanks very much for that. In terms of the next agenda item, it's the work plan. Now, obviously, the work plan is, as I just mentioned, really, it's going to be very much driven by the new plan, the recovery plan, the modification plan from a social care perspective, and hopefully we'll have more to say on that in October. I haven't really got much else that we can say on that at this moment in time. And then the next meeting, as it says in the agenda, will be the 21st of October. Does anybody want to say anything about the work plan or ask anything before I move on?
Certainly, I think social services is going to be in a state of flux for a while. Yeah. And I think you need to be talking to Cabinet members before you make any sorts of decisions of what they want to look at and what we need to bring back here. Okay, yeah, that's fair point. That's what we'll be doing packs, and also obviously along with the directors and the senior officers as well. So that's great. So as it says in the next meeting is the 21st of October at 4 p.m. But at this point, before I close the meeting, can I just take this opportunity to really thank everybody that's worked so hard for us and with us over the last 12 to 18 months. Obviously, Democratic Services, predominantly Alison. Thanks, Alison, for everything, all the help and support you've given me over the last 2 years, particularly, because obviously I'm starting from a low point of knowledge around these processes. So I've learned a lot along the way, and I wouldn't have learned it without you. Thanks to Jeremy when he stood in on the rare occasion where you've been on leave. To Simon, massively for everything that you've done, Simon, for the last 2 years. To Chris Francis and Jane Whitmore, who've done sterling work on transition and on commissioning. Lisa Banks as well, we should mention, who was obviously, we drew on her knowledge. Hopefully we'll do that in the future. So Dave and Julie, I'm sure in the scrutiny earlier, Paxton, you wish Julie all the best for her retirement. She's been a great servant to Swansea. All the legal department, Lisa, who's with us today, who's been there most of the time, but also the other officers who've come along when Lisa's not been available. And to all of you as councillors as well for supporting the committee and working so diligently and turning up pretty much every time. So thank you all very much, and thanks for attending today, and I'll see you all hopefully in October. Thank you, Chairman.
Thank you, Chair.
All the best, guys.
Thank you.
Thank you.
Bye.
Bye.
Bye all.
Bye.
Bye.
Bye.